Welcome to Unsheltered Conversations, the podcast from HomeAid, where we explore the people, partnerships, and policies shaping solutions to homelessness across the country. I'm Scott Larson, CEO of HomeAid America. Today, we're talking about something that happens every January in communities across the nation, the point-in-time count, an important effort led by local Continuums of Care, coordinated nationally by HUD, and made possible by volunteers and service providers on the ground. Joining me today is Matt Bates, Chief Operating Officer of CityNet, one of Southern California's leading nonprofit partners working to end homelessness through compassionate outreach, housing navigation, and data-driven collaboration. Matt and his team play a critical role in coordinating Everyone Counts Orange County, one of the largest point-in-time counts in the country. Matt, welcome. It's good to see you and great to have you here.
Thanks, Scott. It's great to be here, and thanks for inviting me. I appreciate the invitation and the opportunity to talk about the point-in-time count.
Yeah, and I'm really looking forward to diving into a subject that a lot of people either have never heard of or know limited about, and so hopefully this will be an open and educational conversation. But for our listeners who may not be familiar with, can you start explaining who CityNet is and how it began and what your role is with the organization that you've worked for quite a long time?
Yeah, so CityNet, we're a homeless services nonprofit. We were founded in 2003 in Long Beach, and then I joined in 2013. And since 2013, we've really kind of picked up and accelerated our homeless services. So we're now in 10 counties across the state. We do street outreach and engagement. We do housing navigation and shelter operations. We operate permanent supportive housing projects. We do housing development, and we do police diversion programs where in communities, if there's a homeless need in the community, they can call our teams directly, and our teams will go out and send teams as opposed to calling law enforcement. And then we do censuses and point-in-time counts, which is what we're mainly talking about today. In Orange County, we're getting ready for the 2026 point-in-time count. This will be our fourth point-in-time count. And then we've done two other big countywide data collection projects for the county in 2023 and 2025. So we're experienced in Orange County. And then outside of that, we've done over 50 censuses for cities and other jurisdictions up and down the state, trying to collect data about homelessness, the realities of homelessness, the numbers of people experiencing homelessness, where they are, and their demographic characteristics.
Yeah, and when I first became aware of CityNet, I was running HomeAid Orange County and was part of the Commission to End Homelessness at the time. And your first entry into Orange County was in the city of Anaheim. When you think about all the different people and individuals and groups and churches that are working in this space, one of my initial questions was, well, why do we need another nonprofit coming in to do this work? You know, it's like going into the grocery store and there's a lot of ketchup on the shelf and you're a new bottle of ketchup. How do you find your shelf space? How do you find your uniqueness? And I think the census work that you did for the city of Anaheim specifically was very important. But I do believe that you have a very unique model compared to maybe some of the other groups doing different things, very important work where you're combining direct street outreach with system coordination. And how do you find that balance between your service provider and then convening, helping cities and counties and other nonprofits to work together? Because it's two very distinctive work. It's almost more policy and practice. Can you explain a little bit more about that?
Yeah, it's a great question. And it goes back to kind of our roots as an organization where, we were formulated not directly and exclusively as a homeless services agency. Now that has grown a lot and in a lot of communities that we work in, particularly recently, that's, if they know CityNet, they know us as a homeless services provider. But organizationally, again, going back to our founding, our roots as an agency were in kind of the organizations that were doing Christian community development, assets-based community development. So we were a community development agency that was really focused on strong and healthy communities. And so even to this day, we operate things like underneath the banner of our parent organization, which is called Kingdom Causes Incorporated. We operate anti-human trafficking collaboratives. We do trainings for faith communities. We work in colleges and universities and try to encourage college students to engage their communities and be be forces for good and social change in their communities. And in the past, we've done lots of other things because our big commitment is to strong and healthy communities. And of course, strong and healthy communities, when people are in danger of falling into homelessness, they have safety nets in place and they have resources and they have relationships that they can rely on. And so that ideally they don't have to fall into homelessness. And if they do, there's pathways out that are available to them. So homeless services kind of grew out of our organizational roots and our community organizing, community development kind of perspective. And we looked at homelessness in Anaheim and really every place that we worked as kind of this complicated problem that needed a multi-sector response. And so we were working hard to develop skills to be able to work across agency lines within the nonprofit community, but also to work across sectors, so including the faith community and the business community and city government and county government and all other stakeholders who have an interest in homelessness and who have a stake in seeing it addressed and ideally ended. And that's continued to this day. And I think that's why the transition into doing these point in time counts was kind of a natural for us. We were doing lots of street outreach and engagement, so we were mobilizing volunteers and staff to talk to people who were experiencing unsheltered homelessness. And so we had lots of people who knew how to do that. And then we were also doing a lot of kind of community organizing, volunteer mobilization, trying to get people on the same page on a common agenda with common results related to homelessness within communities. And of course, the point in time count, among other things, is a big volunteer event. It's one of the biggest homeless volunteer, events of the calendar year in the county of Orange, because we're aiming to mobilize over 1,000 volunteers on those 3 days in January.
Yep. Well, and I was personally very grateful when CityNet stepped in 2019, because prior to that, there was a variety of different groups coordinating the point in time count. And we knew that we needed to take some next steps. And CityNet at the time was the obvious person for the organization for the county to employ and to fine tune what we had done the prior years and to really delve deep into it, because as we're going to talk about, this is such a critical data point for cities and counties and ultimately the federal government. So what CityNet is doing truly is powerful, because you are crossing sectors like very few organizations do. HomeAid does as well in the unique work that we do, but you're doing it in a different way. You are a service provider, but you have a voice and a platform with many different cities and government particularly. So let's dive specifically into the topic today, the point in time count. And a lot of people call it the PIT, an acronym. And many people haven't heard of it and may not know actually what it involves. And so can you begin to explain what the point in time count or the PIT count is, and why does HUD actually require it?
So so HUD requires it. I mean, that's a good place to start. It's a requirement by HUD for the collaboratives across the country, which are called Continuums of Care, that are receiving funds from HUD. They're all required within the last 10 days of January every year to do a homeless count. Now, every year they have to do a sheltered count, meaning that counting people that are staying in homeless shelters or transitional housing or other sort of facilities where they might be indoors, but they're still considered homeless according to the HUD definition. And then at least every other year, there has to be an unsheltered count. And so in Orange County, they do the annual sheltered count. And then now on every even numbered year in the last 10 days of January, you have to do an unsheltered count. And that's partly because HUD wants to be able to evaluate the interventions that are coming from HUD, the funding that's streaming down from HUD into the continuums of care. They want to see long-term impact and be able to create a national data set of homelessness. So a lot of the questions that we ask in the point in time count are asked in such a way that HUD is consistent with what other continuums of care will be asking. A lot of the methodology is prescribed by HUD because they want it to be consistent. So you have to pick one of the last 10 days in January as an example to do it, to do the unsheltered count. And the questions that you ask and the way that you ask them, a lot of those are prescribed by HUD. There is some latitude, and one of the points of latitude that Orange County in particular follows is that they've opted to do what's called a survey-based count. And that is the kind of count where we do not employ a statistical sampling methodology. It's really we only count what we see, and we try to survey everybody that we see. I live in LA County, and as an example, LA County would be hard pressed to do a survey based count because the county is so large, both in the number of people in the county and geographically, the amount of territory that you would have to cover in a single day or in 10 days that if you had a 10-day period to gather the data, it would just be really difficult to get an accurate number in LA County without using statistical sampling. HUD is fine with either methodology. They're both acceptable. But in Orange County, they've opted for the past several cycles to not use any statistical sampling at all. And so that means that we mobilize volunteers, we break them into teams, we break the county into the 3 service planning areas, and we send them out to all the areas in all 34 cities, plus county unincorporated areas within the county, and they count the homeless neighbors that they see, and they try to engage all of them in surveys to collect demographic information and other information that is useful for the continuum of care to design interventions that'll be effective in ending people's homelessness.
And it really is, and we're going to get into a little bit of it. It really is a massive undertaking. When I was on the county's commission on homelessness and we were examining the point in time count, I was really concerned with the data that I was seeing because over the couple of years, the numbers weren't consistent. And wherever they had deploying it at the time, they were not being consistent year to year. And so we had to really take a look at, right, what were the ways that HUD could allow us to do the count? And we did decide that what you were talking about, the actual going out into the community and determining certain areas where concentrations are. Because if we were in a very large grid urban area, like let's say New York City, you could walk up and down the streets. But Orange County, 800 square miles. And how do you, in some of it's rural and some of it's city based. And so how do you determine where to send the individual? So at the time, they would determine, lack of a better word, a hotspot or areas and determine mapping. That started months before the point in time count, and to determine where you were going to deploy people, and it got better. So as you're seeing it today, what are some of the biggest challenges to conduct this count, especially ensuring that the unsheltered individuals are accurately represented, because it's clearly an undercount when these numbers come out, because you can't be everywhere. But what are the challenges that are out there to try to get this accurate count?
So yeah, it's a big logistical challenge. Technology has helped us. We use a phone app or an app that people can download onto their phones. They could use an iPad too, but everybody's got a phone these days, and phone technology just keeps getting better and better. And we use the GIS technology that's in the phone, where they can download a survey on their phone and they can ask the survey, and then it drops a pin. And then that gives us on the back end pretty instant access to the data, and we can start kind of analyzing the data right away. And you don't have in the old days that you and I are both old enough to remember, you
Yeah.
used to do it on paper, and then
Yep.
you would have a certain number of errors by transcribing, because you'd have to transcribe what was on the paper and enter it into a database. And it was like, did this person, how do they spell their name? Did they spell it, you're trying to decipher handwriting and all of those things. And now technology has really become our friend and allowed us to do a lot more. We still do the hotspots and the mapping. So we've had teams working since July 1 on this project, and they've gone to all 34 cities. They're in the process of creating over 500 maps. So they've broken the county up into 500 smaller maps that will be delivered to teams on the days of the count. And so every team kind of has a specific region that they're covering. They've got a certain set of maps, and on the maps, we've located the areas where we particularly want them to go. And we've even been able to work with law enforcement in all 34 cities, whether that's the sheriff or the local police departments, to identify spots that law enforcement's required either to give them access, maybe like a good example would be like a flood control channel,
Right.
where the public is not allowed to go down there. If they go with law enforcement, they can unlock the gate, first of all, and then they can escort them down into the flood control channel. So it's access and local knowledge that law enforcement has, and then also public safety. If there are areas of the city that volunteers are going that law enforcement's nervous about, they can tag along and just make sure that everybody's safe.
And
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 then we
that's
do
a,
it.
and that's a really important point, because uh, the last time that I participated, 2 years ago, in the point in time count, you show up at 4:30, 5 o'clock in the morning. It's dark. It's not dark 30, but it is still dark. And we were put together with a team, and there was law enforcement that went with us, because we did go down into some of the flood channels and areas that normally one wouldn't go. you're coming across individuals that might still be sleeping or just coming out of a night of activity and different things. So having law enforcement is really important. And what I found interesting when I did the last time, the law enforcement knew a lot of these individuals. And so there was a relationship, and some of it was positive and some of it not so much. But it allowed us to not only do the count, but to enter into the potential of the survey. And the survey is very important to understand if someone is a veteran or their background or if they've been a victim of domestic violence, a number of the different questions, and even demographics as far as race and ethnicity, because all of that data is so critically important with the point in time count. Any thoughts that you want to share about the morning of, if one of our listeners is saying, hey, I want to volunteer, what that will look like for them when they show up at their local library or community or center or the deployment center to go out on that morning?
Well, yeah. So first of all, if they're interested, the place to go is everyonecounts.oc.org. So that's the website. There's a website with lots of information. And so if they want additional information about what the count is and what does it do, and there's copies of previous point in time count reports that they can read through and kind of get a sense of what data is captured and what the county does with the data. But there's also trainings that we provide ahead of time. And we'll be doing in-person trainings in January, and then also have like a Teams meeting or a Zoom meeting like we're doing now, live in-person training, but remote. So from your home, you can log in. But if you got questions, that the instructor will be there to be able to answer your question in real time. And then we'll also tape them, and so you can watch them. If you can't make any of the in-person or the live events, you can watch them after the fact. And so that's extensive training. We go through all the questions that are going to be asked. We go through the maps. We go through safety and security. We go through why we do the point in time count and what is it for. We go through the schedule, and you asked about that. And so we do go out early in the morning and late in the evening. It's dark virtually the entire time that we're collecting information. So what we're trying to do is we're trying to engage people who are experiencing unsheltered homelessness when they're either sort of settling down for the night in the place that they're going to be spending the night, or kind of getting up and getting going for the day. Because during the middle of the day, it's just it's hard to find people, and there's so many more members of the general population that are out
Right.
and about.
The community that's out and about.
The general community, yeah. So that's a challenge, because not everybody's up for getting up early and driving in and volunteering at those hours. Um, you know, you asked earlier about what are the challenges. The things that we worry about are things like weather. That the point in time count goes on, rain or shine, hot, cold, windy. Any once we've declared the date, that's what we do. And we go out and we count who we see on those dates. But we have two deployment centers per service planning area. There's 3 service planning areas, and then we go out in the morning and we go out at night. And so 2 times 3 times 2, that's 12 different events over 3 days. And we're trying to get a total of 1,000 volunteers mobilized early morning and late night. Internally, we joke about it's like throwing 12 weddings over 3 days,
Exactly.
but except you're asking people to come at 5 in the morning or to come at 10 or 11 o'clock at night.
At
And
night.
so volunteers coming is also the other wild card, because we rely on the general public to help us go out and collect this data. There's no other way to do it. We ask the agencies and they are very good. The agencies that are like nonprofit organizations or government entities that are involved with the Continuum of Care, they come out and they volunteer and they bring their staff, which is great. But we need the general public too. And so
Right.
logistically, like, those are the things that we worry about, and that we try to prepare for, and we try to prepare for every eventuality. And so we try to make sure that people, when they arrive, if they're new to this project, um, that all of their questions have been answered, that we've addressed them all ahead of time, that we've provided them the training, the resources, the tools, the equipment, and the materials, and the support that they'll need during the event. And then we also try to pair them with somebody that's more experienced. So
Yeah, that's
we
been
have
out
roles.
before. Right.
Yeah, we have roles called team captains, and so if somebody's new, we'll try to put you with somebody who's either done it before, or maybe they work for a homeless services agency and they kind of know their way around. And so we try to set everybody up for success.
And you're describing this in Orange County, California, and my assumption and my hope that around the country that similar systems are in play. So if someone's in Colorado or Houston or Orlando, Florida, that there'll be a group and people can get engaged. And so we're going to create some links in that so people can find their local continuum and try to figure out how to volunteer. We're going to come back to that in a minute. But alongside the point in time count is another very important data set that a lot of people really aren't familiar with, but was very important and is very important for HomeAid. It's the housing inventory count, what's called a HIC. And can you explain what that is and how that coordinates with the point in time count data? And I'll talk about it a little bit as well.
Sure. So yeah, so we have the pit and we have the hick, right? So the hick is, it's what it says, it's an inventory. So it's meant to be an assessment of how many beds are available, among other things, among other resources. But if you distill it down, it's the question, the point in time count is asking the question, how many, among other things, how many people are experiencing homelessness in the community, both sheltered and unsheltered. And then the hick is, how many beds do we have for people that are experiencing homelessness, either sheltered or unsheltered in the community? And ideally, those numbers would inform each other. So if you have, 10 times as many people in the point in time count as you have beds available, then that will signal to the continuum of care that, hey, let's figure out ways to invest, whether it's the funding that we get from HUD or fundraising or other kinds of investments to create more shelter beds, right? Because you want to be able to meet the needs of the people who are experiencing homelessness, particularly those that are interested in getting off the streets and are interested and are asking, hey, if there's a shelter bed for me, I'll take it.
Yeah,
And
where do
where do
I
I
go?
go? Yeah. And so
Yep.
that's what the housing inventory is meant to do. And those are two, I guess the other thing I would say, those are two critical data sets, but there's also there's other data points that are important to understand. And I'll just, like briefly talk about the point in time count in that it is a point in time. And Scott, you mentioned like, no matter how good you do, you're not going to count everybody on that night in January, number one. And then secondly, there are people who are going to be housed that night in January that maybe in July of that year, later in that
Or
year,
not.
they're going to be unhoused.
Yep.
And vice versa. You're going to have some people that are unhoused in January, they're going to be housed in July. And so I think the other thing I would say about the point in time count is that um, it's not a picture of who will experience unsheltered homelessness in your community over a given year. It's really just a point in time. And there's studies that have shown anywhere from you take that number and multiply anywhere from 2 to 12, depending on the community. And that's the number of people that are going to experience homelessness in your community over the course of the next year. And so when you think about things like the housing inventory chart, sometimes what continuums will do is they'll say, okay, well, the point in time count said X, and we just need to make sure we have X number of beds in the system, which may be correct, but it may be that you need to account for other people that are going to fall into homelessness over the course of the year. You need to look at things like system flow through your system of care and those kinds of things. So all that's just to say the point in time count, as much as critical as it is, and as hard as we work to make it as thorough and as accurate as it can be, by design, it's not meant to be a complete picture of homelessness in your community over the course of an entire year or multiple years. For that, you really need to be looking and synthesizing other data sets like the HIC, but there's others out there as well that you can use to give yourself a more complete picture of homelessness in your
Right.
community.
And I know some communities, such as up in the Seattle metro area, they've done that. They've looked at adding a different count because you're right. You've got people accessing food banks and resource centers, and they tried to gain that picture of an annual count, not just a one point in time count. But that's what HUD requires, is that point in time count, and it relies on the data. The thing that I found very beneficial on HomeAid's side is, as we've identified in a community, the projects that should be focused on, the HIC has been really important because you can see where there's gaps in the system. How many emergency beds do you have? How many different various types of transitional beds are there, and even permanent supportive, and even diving into gaps in the continuum of care where you have nothing. If a community doesn't have any recuperative care beds or different things like that. So it's really determining that supply and demand. And as people in the housing industry or as developers, that's what they do all the time. They're seeing what could be done. And so HomeAid has taken that and encourage our affiliates to really use the HIC data as they're identifying where a project either fits that they're working on or where a gap is that they need to do. And a case in point of this was in Orange County, when we were first examining this data, there was limited emergency shelter beds, and that has changed a lot over the years. However, the one big gap was emergency beds for families. Like if a woman and a child were living in their car, yes, the cold weather shelter may have been there, but the HIC data showed, housing inventory count showed that there was really inadequate number of beds for an emergency situation for a family. Intact family, single dad with a kid, multi generations. And so that led to a series of projects that were being developed with a number of collaborative partners. So it's an important data point that coincides with the HIC. So as we look at back to the Everyone Counts Orange County, and it's come together and is very unique. But do you feel that your model is being replicated across the country? And have you had collaborative conversations with other continuums with what you've learned and how they can replicate what you're doing in their area, gathering hundreds of volunteers, law enforcement, et cetera?
Yeah, we have. So we work in 10 counties across the state now, and we have done censuses in a number of those counties, not point in time counts, because everybody has to do the point in time count within the same 10-day
Right.
period. As an agency, we really don't have the capacity and the staff to do more than one county. But at other times of the year, we've seen a lot of traction and a lot of interest in doing kind of survey-based counts that are consistent with the point in time count in terms of like asking a lot of the same kind of questions in the same kind of ways so that you have a complementary data set, but that also give the local communities some latitude to ask some different types of questions that maybe you don't have the time during the point in time count to ask. And so we've seen a big appetite spread that way. We're also, we're connected within the Orange County count. There are a number of agencies that participate together. So United Way to See, for example, is contracted to do the sheltered count every year. And so we partner with them. There's a group called Hub for Urban Initiatives, and they help to consult with kind of making sure that the overall project is in compliance with HUD guidelines and HUD standards. And they do that for lots of other continuums of care. And so through that connection, we've been able to compare notes and share best practices and receive input on best practices from other continuums of care about how they're conducting their point in time count to try to really improve the model and improve the quality of the data, because even with the limitations that I described, it is very important and very useful and very telling to communities about the shape and the color and the framework of homelessness in their community, but also over time the effectiveness of different interventions that they
Different
may have
programs.
tried to
Right.
institute and programs. And like you're saying, it can help to align things like, maybe there's duplications of efforts in one area and an underrepresentation of efforts in another area. And the continuum armed with this knowledge can kind of balance out, whereas maybe, maybe you've got plenty of people that are offering emergency services like food and clothing, but you don't have people that are providing mental health services or medical care. And you can kind of find that out using the point in time count data. And then over time, make adjustments and see how that impacts your numbers.
So we're talking a lot about numbers and stats and data, and it can lend itself to dehumanizing kind of this topic. It's an important piece. So how are you looking at either for the volunteers and really humanizing the data? And that it's not just about data collection, but it's about the people. Do you talk about that with your team or with the volunteers and this experience? Because it's more than just a number.
Correct. And I think the volunteer participation is a big part of that, because the community will get the report. And like I said, you can go on our website or other continuum of care websites across the country and look at their previous reports. And it will be lots of data, um, and kind of a 30,000-foot view of homelessness. But the volunteers collecting that data, like that's a very visceral, personal experience. And so we get feedback every time from volunteers from the general public about how eye-opening the experience was for them. In part because it's the middle of winter. It's not super cold in California, but it's for us it's cold.
Oh, it can be a chilly morning. I mean, it can be
Yeah, yeah,
35
and
degrees.
so when you're standing in a park and somebody's sleeping under a park bench, and the ground is wet from the dew and it's freezing cold out there, uh, and you're uncomfortable as a volunteer and you've been out of your car for 15 minutes and you have a hot cup of coffee in your hand, it's easy for that person to if something clicks in them like, oh, this person was here all night and they're here every night, and this is not a pleasant experience. And the other experience that we get a lot is, um, people typically like to volunteer in their hometown, but we'll take them to places maybe in their hometown that they
That they've
aren't
never been.
familiar with. Either
Yes.
they just don't go to those places, or they certainly don't go at that time of day. So even if it's a shopping center where they've been a million times before, we take them back around behind where the trash cans are, and there's people sleeping back there, and it's in the morning, and they realize that there's this whole other world that's coexisting with theirs that they don't interact with very often, and that it's bigger and more profound than they thought. And those kind of experiences are critical to us because in this county and counties, every county that we work, and I'm sure every place that you're represented, you need advocates for solutions. If homelessness is a housing problem, and I saw that you had the author of that book on one of your previous podcasts, and I appreciate the data that's there because I try to drive everybody to that book just because the data is so extensive and so well done. But if homelessness is a housing problem and we need housing to solve it, we need local communities that are going to accept housing in their communities and not, at the very least not prevent it, but ideally to support it. And so there's every opportunity for every volunteer. We look at it as an opportunity to mobilize a future advocate and to give them a tangible, visceral, personal experience that they otherwise wouldn't have that can be really life changing. And this year, in fact, United Way in Orange County is hosting a series of after events, kind of debrief events where people who have volunteered at the point in time count can come together with service providers and people from the county and talk about their experience and share ideas and share next steps and really just kind of decompress and debrief. And so I'm excited about that because I
Yeah.
think United Way saw what you're talking about, which is that there's an opportunity here for people to really dig deeper into the human side of this, and that every interview, every statistic is somebody's life, and that's somebody's son, that's somebody's daughter, that's somebody's mother, their father, their brother, their sister, and very often it's somebody that they went to the same high school, or they go to the same church, or they
Right.
shop in this, they work in the same locations. We those are not unusual; those are common, and we anticipate that those happen, and that's part of why we really do. Appreciate the survey based counting model is because it does mobilize. We do need the general public to participate, but that in and of itself is a good for the cause to have more people from the general population engaged and aware and connected to what is happening. And it's not just something that these great agencies in the continuum of care are off doing, but it's something that the general public is connected to.
And I saw that directly as we engaged board members to come out and volunteer. And they had that visceral experience. They had that, had their hot cup of coffee and they were just gotten out of their car and they're seeing this issue. And it did change them. I can count numerous of our board members that had that direct experience. So I'm glad that the United Way is setting up those briefing times because part of it is what did I just experience? How do I understand it? And what do I do next? And so when we look at after this data gets collected and there's a couple months that pass by, how do you see, that data rolls up to not only a local government agency, maybe the city, the county, but it ultimately rolls up to HUD. What do you see the change that needs to take place? Or have you seen where that influence has created real change? I mean, because we're doing these numbers, but are there times that you've seen that influence in outreach or housing programs that things have changed over time since you've been doing this?
Yeah, absolutely. Like you hinted at one of them, which was that in the early days, we saw in Orange County anyway, we saw a real need for shelter beds. And so, that kind of spurred cities and the county into action and even nonprofits to kind of ask the question, what would it look like to make investments in shelter beds? Another one that was really dramatic was healthcare, health insurance. So remember when the Affordable Care Act passed, now everybody could access healthcare, but you had to enroll.
Right.
And so we would ask the question during the point in time count. One of the questions is, do you have health insurance? And if so, what type do you have? And the numbers were really low. They were distressingly low given the fact that what we knew about the healthcare needs of the unsheltered homeless population and the availability of this resource that was designed to help in part people like them, but they were not connected, right? the people in need were not connected with the resource. And so what happened was taking that data at the shelters, groups like the healthcare agency would show up with their staff and their tables, and they would enroll clients into health insurance, healthcare. And so now when we go back years later and ask that 2 years later and ask that same question, we saw the percentage that had healthcare had gone up, which was great. And now it's gone up to the point that we don't even really need to do those interventions anymore at the shelters. But they were doing like, they would have like a mobile van that would go out, and they would set up shop at the shelter, and they'd sit there all day and enroll clients into healthcare, so that people who were at the shelters, and they would do it on, they would go out with groups like ours in street outreach, where we would go out even on the in the field and just sign up homeless neighbors in encampments and in other places. And that was an example where looking at the data, the continuum recognized a need and began to make adjustments. I can say that now, one of the things that is being tracked closely is chronic homelessness, because in a place like Orange County, where they've made investments in shelter beds, a lot of the people that are able to access the shelter system have done it, and they're in the shelters now. So they show up in the sheltered homeless count. But what's left on the streets in many cases are either people that have newly fallen into homelessness and or these kind of chronically homeless people that have been homeless for a long time. And if people aren't aware of the chronic definition, that speaks to a length of time that a person's been homeless, but also to disabilities. So things like physical disabilities or mental health, severe and persistent mental health issues or substance abuse issues, things that are preventing that person from living successfully, independently, and in some cases from preventing them from working, like the disability is so
The
profound.
disability is, yep.
Yeah, and so if we're left with that group now on the streets, right? How do we alter the system of care? How do we alter things like street outreach and engagement? How do we alter things like new shelter construction, so that we can connect with and we can provide resources to that group, because they're not going to be able to function necessarily in the shelter system that we designed
Yeah,
years ago for other people that didn't have those same issues.
right. Because they're the most, probably some of the most difficult to serve.
Right. Right.
So as you look into the future, assuming CityNet is still engaged in future point in time counts, are there some things that you're working on? You mentioned technology, the app. Are there other innovations or improvements that you hope to see that will help improve the point in time count in the future?
Yeah, I would point to like things that the county has done, um, with CityNet in 2023 and 2025, where we didn't do a point in time count in those years, but the county engaged our services in a countywide data collection project. And so this past year in 2025, we really looked at asking more questions. It was a longer form survey, more dialogue, more open-ended questions, trying to get at a person's experience with how did they become homeless in the first place.
Right. Versus race or ethnicity, or are
Yeah,
you a
you're just
veteran?
yeah, that's right. You're limited with you have some demographic information that you have to ask during the point in time count. And again, you're trying to count as many as you can in a very limited window. And so we keep the survey to like 20 or so questions. Well, in 2025, I think we had over 70 questions that we
Mm,
asked. So it was a much longer survey. And it got into depth about like when, not only when did you first become homeless, but we looked at people's financial, situations. And, we looked at substance abuse and substance use. We looked at abuse and things that we know as a continuum of care are contributing factors to people when they fall into homelessness. But allowing our homeless neighbors to kind of stretch their legs, if you will, and tell us those stories, I think was really helpful, and I think is something that kind of gets to one of our challenges that you asked about earlier, which is that how do you pair this really important kind of macro level data, these numbers, pair them with the reality that each of those numbers represents an individual and somebody that is, suffering on the streets and is in desperate need of care and resources and a pathway to housing. And I think my recommendation would be that the county in the future, whether that's, whether that's with us or with any other agency that would do the point in time count, would be to look at ways that they can maybe do some longer form interviews. So is it possible to like pull a subsection of people that participate in the point in time count and do an hour long open ended interview and
right.
kind of tell those stories along with the empirical metadata, so that you're highlighting, maybe a veteran and maybe a family, maybe somebody that fell into homelessness because of a domestic violence issue, and do these things tastefully and without exploiting the people that are participating, but do them in a way that broadens the message so that it's not just like this is a data set that checks the box that we can send to HUD so that we can get funding from HUD and continue the programs that are important for us to offer, but so that we can really educate the population about the realities of homelessness in their community, and really begin to connect the dots that these are your friends and neighbors, and these are people that are struggling financially. They're struggling economically. Many of them are working, and it's the one paycheck away, one negative life event away, and then that begins a chain of events. And now they're facing life on the streets and navigating a really complicated system of care. And if we can disrupt that and prevent that from happening, there's a massive humanitarian good to that, and there's also a societal good, because it's like anything else. To prevent this from happening is so much more effective from a resource allocation standpoint than trying to intervene once it's already happened.
Yep. No, you couldn't agree more. And I think the awareness of whether or not it's economic or other things, that this issue is so close to people, closer than they ever could think. And what will they do about it? And what's the call to action? So I hope that people that are listening to this and listening to you and me talk today, that they will be motivated to go volunteer. You mentioned it earlier, and we'll put it in our notes. So again, how do people get involved with the count in Orange County? And then we're going to put some keywords for people to do, let's say, a Google search on how they can get involved with their own community. So what should people look for, and how do they get connected?
So for us is just everyonecounts.oc.org is the place to go. And we're enrolling volunteers now. And so if you know that you want to do it, we're asking for early volunteers, because, typically people wait till the last 2 or 3 weeks
Yeah.
before the event.
As with many things, yes.
Yeah, with many things, that's human nature. And plus we're in the middle, we got the holidays. And so we get it. There's other things that people are focused on here, right in the middle of this. But if you know you're going to do it, to volunteer early. And then if you're not in the community of Orange County, yeah, I would recommend looking up your local continuum of care and seeing if you can volunteer for the local point in time count, or just get involved with the continuum of care. As you know, Scott, these are entities that are made of volunteers, that are made of members of the community, members of these organizations that are engaged in homelessness, and they're open to the public. And in many cases now you can log in from your home and participate that way, and follow along with the community. But you'll learn a lot about what your community is doing to address homelessness and what the challenges and the needs are. And I think that's also a good way that people can get involved.
Yep, absolutely. And it could be you as an individual, it could be your family, it could be your work, it could be your faith community. We need everyone to be engaged and involved. So I really appreciate our conversation today, and what you and your team at CityNet do, not just the point in time count, but your service provider work, your advocacy work, bringing the housing and care and hope to people out there. So the point in time count, for those that are listening, may only happen every other year in your community, but it reminds us of the ongoing truth that everybody does count. I love the name of where you pointed people to go, because everybody does count, and every person deserves to be seen and counted and ultimately housed. So again, for those that are listening and want to learn more about CityNet, you can go to citynet.org. They would welcome you to support their work, sign up to volunteer for Everyone Counts in your community. And you can find more resources even by searching HUD's point in time count and housing inventory count at hudexchange.info. So thank you for listening to Unsheltered Conversations. I'm Scott Larson, and Matt, thank you again for participating. Together, we're going to be building a future without homelessness.